Well, good morning. My name is Rick Padilla. I'm here as a father first, and my story is a lived experience. I have two boys that are Cherry Creek High School. One graduated in 2017, top of his class, presidential scholar, over $1 million in academic scholarships across the country. The second is my 15-and-a-half-year-old son, Jack. Jack passed away February 14th of this year. He died by suicide. Jack fought for his life for 9 days in the hospital, but the injuries were too catastrophic. That kind of threw me into a world that I was not familiar with for many years. Early on in my career, I started out as a protective service worker in Jefferson County. I also started a diversion program in Kansas for some offending youths. And I also worked for the Menninger Foundation for a couple of years on a national project around youth and youth advocacy. It was early on in my career. Many years after that, after I graduated law school, I'm a houser. My most recent position was the director of housing for the city of Denver. When Jack passed, my life changed, our lives changed. I took 6 months leave of absence. I was fortunate enough to come back to the city under a new position, which I'll talk about just briefly. The city, we feel like it's our commitment under Mayor Hancock to help lead this effort as the largest jurisdiction in the state around mental wellness and mental health. I've assumed a new position that they've created around suicide prevention. Some of the folks in this room I've worked with, and I hope to work with most of you in the future. Some of the things that I want to just briefly talk about, I know some of you have heard my story, and I've advocated quite a bit over the last 6 months. I feel like in order to make any systemic changes, people like myself, we have to open up our story. I've met many of the families, from the Bales to the Eckerts to the Drurys and many other families who've lost children this year. And I understand the grief that you go through as you want to close up and try to heal. Certainly my family and I are trying to do that as well. But I think it's important that we have to address the issue of stigma around mental health. And one way we do that is for people like myself to get out and be public about it. I spoke last night at the Cherry Creek School Board meeting. I'm speaking this afternoon with Channel 9, Friday afternoon with Channel 7. We've been all over the press, and I think it's important. It's difficult to share our story. Jack was a lovely, compassionate young man. As I've learned, like a lot of young people that suffer from ADHD, as Jack did, and from clinical depression, they're very compassionate. They tend to give more to others than themselves, and they tend to mask their depression quite well, and Jack was one of those people. But it's now time to kind of look forward. How do we save the next Jack, or Kearney, or Leslie, or Nick, or the rest of them that have passed this year? I have some ideas, and hopefully we'll work with some of you folks. I think we really have to go upstream with this in the elementary schools. And I think that what we as parents, if we go upstream, we don't want to know the great services that are out there at the time when you're in a crisis. That's when we learned about the great services that are out there. I've worked in government, local government for a short period of time, but at the national level as well. And I know we don't get the resources to market and do outreach. And that's a big challenge. And I think that's where public-private partnerships come into play. I certainly have talked with Health One. I'm meeting with them again today. I've spoke with Kaiser. I have every intention of talking to UC Health and others. We have to build these partnerships. The insurance industry needs to be at the table with us as well in terms of collaboration, as do school districts. And I understand that school districts have elected officials. And I am not telling you anything I had not said to Representative Cordova, to Scott Siegfried. Elected officials and school boards are separate elected bodies. I understand that. And sometimes they can be fiefdoms, and they need to be at the table with us. And I was quite clear with the district board members last evening, you need to be at the table with us. They had put out, which I thought was a great PSA that their students had put together. They pushed it out on YouTube on teen suicide prevention. I thanked them for it last night. I think that was quite courageous of the students to do that. But my question to them was, we've been working with the Attorney General's office, Office of Behavioral Health, and others in creating some public service announcements that will be rolled out very soon. I said, why were you not at the table? I've invited you all summer to join us. Your students have stepped up and filmed. You need to be at the table with us. We're not going to do this. This is a community-wide epidemic, and we have to, as a whole community, need to work on some of these issues together. I think that one of the things that I think would be great, many of us, I don't know if they still do that, but many of us are the age we remember the President's Council on Physical Fitness. Why can't we have the Governor's Council on Mental Wellness? and you incentivize what you want schools to do. You know, it's not an unfunded mandate, but you incentivize them. We can figure out, we're smart people here, you're smart people, figure out how you incentivize schools to do that, to get the young people excited. That way you're going upstream. I think that I'm talking with some folks this afternoon. I think it's important that suicide prevention become an offering for continuing education for both our teachers and our clinicians. It's not today. It needs to be. They're part of the front line. They're spending 7 to 8 hours a day with our kids. I applaud to a degree the Colorado High School Athletic Association. They now have a voluntary 20-minute online suicide prevention course. It can be deeper, and it needs to be deeper than that. These coaches spend a lot of time with our kids, and I think there's opportunity there. Another idea that I've talked with some folks about is we have youth commissions in different local jurisdictions. We also have grassroots organizations. Like when my son passed, a lot of his classmates and friends came to us, and we didn't incorporate, have no intention of incorporating a C3 or a foundation, but they said, we need to do something. We need to be heard. They started a group called Jack Strong. We met again this Sunday, and we've done a lot of things with these kids over the summer, from school walkouts to I started a lacrosse team that they played in a high school lacrosse team, kids across the metro area, just in the spirit of wanting to get their message out there and that there is hope. I think that what we can do is a statewide alliance of these kids, empower them. They need to be at the table. We can communicate with these youth commissions. These are functioning bodies. The grassroots organizations are there. The parents that are behind that, we're willing to step up and support them and do what we can to help them. I've talked to all of them, from the Happy Crew in Highlands Ranch, the Bales, Nick and Maria Bales, certainly the Eckerts and Robbie's Hope. So I think that those are just some ideas that we can all work together collaboratively. And on behalf of the city, I can tell you we are committed, first and foremost, to address this very critical issue. This is an important day. We know today's World Suicide Prevention Day. It's a big day for all of us. This is a big month. So I just am here today to share Jack's story and let you know there is hope, and that from a father's standpoint, I'm committed, and from the city's standpoint, we're committed to making a change. Thank you.